Vanakkam, this is Dr. Sangeeta Biagi and
my name is Jenita, Caren. I'm from India.
Yes, and I'm from Italy. And we're currently at the Institute of Salutogenesis and Complementary Medicine in the School of Music Therapy, where we're both faculty. You, what is
I'm
your role?
an assistant professor here.
And I'm an adjunct faculty. So we are preparing an online course on music medicine. And we had the idea while we're here together to actually share some of this with you. What is music medicine? How is it different than music therapy? And music therapy is the specialty of Professor Jenita. And mine is Nad Yoga and Nad Yoga Chikitsa. So we thought we would share with you just maybe some thoughts.
Yes.
So we decided that I'm going to ask Jenita a question and then she's going to ask me. Okay? So,
Yes.
what is the difference between music therapy and music medicine?
So to talk about music therapy first, music therapy is a professional use of music and its elements to help people enhance their health and well-being. So people need actual training and education and qualification to become a music therapist. But there are, some people who are healthcare professionals who don't really have the time to get a degree in music therapy, or they don't have the musical expertise to, practice music therapy and play songs or musical pieces for their clients. So these healthcare professionals can take up music medicine, which is actually the use of music as a listening method. So they can use headphones where the healthcare professional who doesn't want to sing may not sing for the client. So they can talk to their clients who are very anxious to get into surgery, for example. They can talk to them, they can get to know their clients, they can get to know the musical associations that they have, their preferences, what they like and don't like, and they can choose the appropriate music which they can play for the patients before they go for surgery or during surgery or after. So this is the basic difference. So I can say that there is no therapeutic relationship in the concept of music medicine, but in music therapy, therapeutic relationship is one of the major things where the therapist is there for the client even when there is no music.
Wow, very nice. So, well, I guess I have a second question for
Okay.
you. We thought of just one question, but we'll just maybe do 3 questions.
Sure.
So, what is your experience? What are you working on? What is your research currently? And
Right now, I'm also doing a part-time PhD program here in the university, and I'm working on an interdisciplinary research with children and adolescents with autism spectrum disorder. So my PhD is still in the preliminary stage, but as a preliminary work, I am working with also regular work for me. I am working with children with autism in general. They come to the music therapy OPD here as clients. So I work. One case that I'm working with, I've also shown some videos to Sangeeta ma'am on the conferences, is I'm helping the child with autism spectrum disorder. He is around 12 years old, and we are singing with him. Basically, it's not any other technique. We are just singing with the child, with the parent, and with another therapist there to create that group scenario to enhance his social skills. He, as a child with autism, is still much better because he is having a lot of therapies going on for him. So he doesn't have any basic issues like difficulty in eye contact or attention span. He can do things very well when he's alone, but he doesn't do things well with others. And music, making music is a very social activity which brings people together. So I'm using singing with him and with his parents and everyone to enhance his social skills. So
you're having very good results.
yes, there are very good results. And apart from that, I'm teaching.
Okay. What are you looking forward to? This is the third and last question in terms of your research and sharing your wisdom with others. And what is something you're looking forward to?
I am looking forward to working a lot with children, children with special needs specifically. Apart from the autism spectrum disorder, I am also guiding a few master's students to do research in children with cerebral palsy and also in children with specific learning disability. So I would like to see how, there are intricate differences in the therapy that we do. It can be individual sessions, it can be group sessions, it can be a combination of any 2 particular techniques, or it can be a combination of other 2 techniques. So I would like to see these intricate differences that, I can project to the people all over the world who do music therapy to know what they can look for or what they can expect in those children and what they can use as a preliminary goal, because each child is going to be different. I cannot generalize that this technique is going to help every child with autism spectrum disorder or cerebral palsy, but I can maybe set the path, because in India the research in children with special needs and music therapy is still not developed. It is very nascent stage. So I would like to set a trail where a lot of people take up, because people think only adults have a lot of issues. People who come to the hospital, who get admitted, have issues. Only chronic diseases are, serious. But they don't really see that in the roots, children like this are suffering so much and they don't have the financial support to get help. So being a music therapist here in this hospital, I can provide music therapy for free for these children, and I want to use this avenue to create more and more evidence.
Wow.
Thank you.
Okay. So?
Yes, I would like to, in continuation with that, I've seen you talk a lot about Nadi Yoga and Nadi Yoga Chikitsa, but specifically with children with special needs, I would like to know if there is any avenue that we can create, or if there is already some avenues that is working. So I would like to know in that perspective.
So when we talk about Nadi Yoga and Nadi Yoga Chikitsa, we're talking about teachings that have been handed down orally from generation to generation in a system of Guru Shishya Parampara. So the ones that I'm sharing are from the Parampara of Swami Gitananda Giri, and they always include care for children. They include care for the human as a whole. Now at Saiter first, and then now at the school, in the School of Yoga Therapy, there's quite a bit of research done on children with special need. Dr. Meena Ramanathan, for example, has done quite extensive research on this. So what seems to work very well, of course, as you said, each child is very different, and something that works with a child may not work with another child. But generally, when you need to, as you know from music therapy also, when you need to get the child's attention, allowing the child to be free, to be expressive, if possible using the instrument of laughter and play and fun. So bringing together Hatha Yoga with Nadi Yoga practices such as animal sounds, crawling around, or making sounds of birds, making sounds of pets, dogs, cats, etc. May be a wonderful bridge to start to create a rapport with the child, or a sense of intimacy that, as you know very well, is very important. So Nadi Yoga, even though Nadi Yoga often is understood as the study of very subtle teachings like the swaras of classical music, or the chandas, the hymns of the Vedas, how to intone the Vedas, how to intone the mantras. It can also be applied to sounds of everyday life, laughter and sounds and so on. So I would say that we can begin with that type of approach. Now, if children have the capacity to follow a more linear teaching in a sense, then we can also help them become aware of the sound of their breath. Now, of course, that requires a little bit more capacity to focus for a prolonged period of time, so it depends. But listening to the sound of the breath is a revelation for everyone. Not a lot of people listen to the sound of the breaths. The Soham mantra is really a seminal teaching of Nadi Yoga, because the sound of the breath is a reflection on everything that exists in our life. We're born on an inhale, we leave our body on an exhale. Our life could be thought of as one big breath. Inside those, there are like 21,600 breaths that we take every day. So there's so many life and birth and rebirth every day. So you can go so deep, or you can go very light and very simple as to say, let's focus on the breath. Let's notice the sound of the breath. Let's make a sound with the breath. So inhale and exhale with ah. Oh, this one is the inhale, this one is the exhale. When we are stressed, we make the ah really long. When we need to have more energy, we make short, powerful sound like ha, 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 yakara kriya. So depending on where the child is, the age of the child, and how they can follow you, you have practices that go from very simple to complex. The great thing about this though is that there's no hierarchy of importance. So the Soham is both really accessible, and yet it's one of the most important teachings of Nadi Yoga. So it's not like, oh, you know, you're gonna just do the animal sounds and here we're gonna sing the most amazing mantras. There's no judgment like that. They're all part of the Nadi or the sound of nature, you know, so that's what I love about it, is that there's no hierarchy.
Yeah, that's great to know that there's no hierarchy, because people might think that these children cannot do certain things in Nadi Yoga. Maybe it will take some time. So I will not ask you that question. How long it will take for this child to learn all these practices of Nadi Yoga? Because that's what people ask me as well. How long do you think this child needs therapy? That we cannot say that. It depends on the child. It depends on what the child likes and everything. But is there a role of cognition, or even children with severe cognitive delay can still learn these things? What do you think on that side? I'm not asking about the duration of how long it will take or the age, because in these kinds of children we cannot actually consider the chronological age.
Exactly.
They do not fall in the developmental pattern of the chronological age. That's why they have a delay. So if they have severe cognitive impairments, will they still be able to do this, or is there a specific way to approach it? Like you said, animal sounds they can still understand. But you know, listening to the breathing is difficult even for me.
Exactly, and that's what I wanted to say.
Very difficult. I get anxious.
Exactly. A lot of people feel that. It's a very good question. Thank you so much. In fact, we cannot say, not even of children or children with special needs, we can tell about this, how long it will take, about anyone. Because the thing about Nadi Yoga is that it's not, okay, it's something we do. Okay, we use sound, or you use the ukulele or the guitar, sure. But beyond that is becoming attuned to a vibration that is already existing. This is the spiritual teaching of Nadi Yoga. Of course, quantum physics will tell you there's a quantum field of vibration, so it's not just a mystical, it's a truly macrocosm, microcosm. So there's two layers. One of them is I am going to do something to attune myself to the sound. The second part we cannot will, which is I am going to feel the vibration of the sound. Now, a person with cognitive delays may not be able to make a lot of sounds. That does not mean that they don't feel the vibration spirit. In fact, these children are quite gifted. So this is the thing, it's like, you know, when we go into Nadi Yoga or we go into music performance, people think the better I am as a musician, the more effective my practice will be. Yes and no, because there's this aspect of bhakti. So to answer your question, of course, we don't have time. We don't have a time. In a year, you'll be able to do this. Now, the goal is not to be able to perform Nadi Yoga practices, as in kirtis and you know, just get on stage and sing, you know, concert. That's not the goal. The goal is the child feeling joy? Is the child able to relax? So that other forms of therapy can come in and help with speeding up the cognitive process, or helping with mobility, or helping with social bonding, the work that you're doing as a therapist. So as Dr. Nanda is saying, one of the greatest contribution of yoga to the healthcare system is relaxation. And so sound should be relaxing. Now, if the child is very energetic, it's not going to be useful to bring the Om, because they're just not going to be able to manage it. You know this very well. That's why I brought up fun sounds, the sound of laughter or the sound of animals, because generally animals are more fun than speaking or saying the lyrics of a song, right? So in that sense, I think, yes, there is this aspect of music medicine that is the spiritual aspect of health, so the spiritual approach to holistic health that Nadi Yoga wants to bring, especially Nadi Yoga Chikitsa, is a commitment to bring this into the health system and understanding spirit. So to end the very long answer, spirit in Latin is connected to the breath. Spirito means both to breathe and spirit. So as long as the practices help the child. Become aware of the breath, even not regulating the breath, but look, we're inhaling, exhaling, like even just that is a huge leap in consciousness from a psychosomatic point of view.
That makes sense, because even if they are able to listen to their breath, these children are not able to say that I can hear it.
Yes.
So making them just conscious of what they are doing, I think will solve a lot of issues.
Yes.
They don't have the control. If the child is hyperactive, it means that they don't have the control to know that we are in an environment where I have to sit for some time and listen to what the teacher is saying. But they don't have the control. So if we give them the sense of consciousness through these techniques that you say, it will really sort out a lot of things. And to help them, it will be like a push start for them to improve in the other areas. If they are able to consciously control what they do, they will be able to better benefit from the other therapies that they are receiving, able to enhance motor skills or cognition or language skills. It can be anything.
So the breath, of course you can feel it, but you can also see it. You can see it on a mirror. So for example, inhaling, exhaling, you can feel it on, with due respect to the person's boundaries, of course, but you can feel it on the hand. So what is this? Just to have a reflection on what is this and how does it feel to breathe? Just as a game. It's a very important step because, as you said, you can't really, for all human beings, if we're not aware of the breath, we miss on a lot of different other things in our process. So, dear friends, this is the Italian hug.
Yeah.
So out of context.
Okay.
People don't really hug. Oh, they hug. So, if you're interested in learning more, contact us. The contacts are below, and you can let us know if you would like to learn more about music therapy, Nad Yoga, Nad Yoga Chikitsa, and also how we communicate, in these different approaches.
And if you also want to have some conversations like this with us,
Yes.
we can have some collaborations.
Yes, we can. Yes, so we would like to have collaborations on my end. I would say with people who work with Nad Yoga Chikitsa, Swara Sadhana, Mantra Sadhana, especially if you're coming from paramparas that have been living traditions for a few generations. I would say I would have to specify that. What about you?
People who are musicians, people who are healthcare professionals, rehabilitation therapists, special educators, or just people who are inclined and interested in music can always contact us.
Yes, and as I'll just put the title there, as the Director of International Research and Studies of Nityananda Nada Yoga, I am planning to start monthly meetings of researchers and collaborators. So let me know if you'd like to add your name and contact so that next time we go live on Zoom, you can be part of the conversation. All right?
Yes.
Thank you.
Thank you.